The other day, a student asked me, "Erwin, what it's like to be a doctor?" When that student asked me this question, it reminded me of when I was in the shoes of that student and I was considering a career into medicine. If you're thinking about going into medicine, then you have some expectations and some idealization about medicine, and this is why you need to watch this video. In this video, I'll go through 5 reasons for not going into medicine. This is not meant to discourage you. It is meant to give you an insight, a real insight into medicine from my perspective. If you're new to the channel, my name is Dr. Erwin. I have high performance, great habits to lead a happy and successful life. In this video, I'll share with you my honest insights of medicine, what it really is to become a doctor. Reason number 1 for not going into medicine: money. If you think that you will become rich when you become a doctor, then forget it. Becoming a doctor takes a lot of sacrifices and you will have to make financial sacrifices. When you become a doctor, there's a lot of expenses that you will incur. Many doctors have student loans that they have to pay, and they have to pay this throughout the years they work as a doctor. And this is quite a significant amount of money that you will need to repay. The training to become a doctor is also long, so you'll be spending time in university whilst other people will be working, so you won't be making much money or saving at all because you'll be spending this time working on placement and studying for your exams. Once you become a doctor, you will start earning some money, and with that money you will have to repay your student loan if you have any loan, and you'll find that you make a comfortable living. But it's not a huge salary, especially if you're planning to buy a house and found a family. You'll find that you will have other expenses as a doctor, and the salary that you get is sufficient, but it's far from what other people might think a doctor will be earning. So if money is your primary motivation to go into medicine, you will be disappointed. Go into something else. There are other professions, other careers where you'll earn huge salaries, such as becoming a lawyer, going to investment banking. So if you're going into medicine for money, then forget it. The next reason for not going into medicine is family pressure. There are many doctors who actually became doctors because their parents, their family had so much pressure on them to go into medicine. Perhaps their parents were also doctors and they wanted their children to become doctors, so that's how they followed this path, and they don't really like the fact that they become a doctor, and this is because they did not want to disappoint their parents and they wanted to please their family. If your family is pressurizing you to become a doctor, then this may be not a good reason for you to go into medicine, because you might not enjoy it and you will find that you might regret that decision. So it's very important that you realize that this is your life, and if you want to become a doctor and that's what you want to do, then it's different. If it's somebody else making that decision for you and you don't want to disappoint them, or you still want to please them, and that's what's the reason you're doing it, then maybe medicine is not for you. I recommend that you think about it carefully and have a chat with your family, because it is a very important decision, and this decision will determine the trajectory you have in life. So think very carefully as to what's the reason you're doing medicine. Are you doing it for yourself or for your family? Next reason for not going into medicine is you think that medicine is a cool profession to be into. Maybe you've seen House, maybe you've watched other movies where they portray doctors and they portray medicine as a glamorous profession. Well, let me tell you, medicine is far from being a glamorous profession, because when you work as a doctor, you will be dealing with bodily fluid, such as urine, such as vomit, blood. So this is not a glamorous profession. If you're a bit squeamish and you don't think that you'll be able to handle it, then medicine may not be for you. I still remember first year of med school, we had our first anatomy class, and one of the classmates actually passed out just by smelling the course and having to dissect the course. So if you're going into medicine, know that it's not a glamorous career to go into. If you can handle it, then that's fine. I think most people will actually be able to get used to it and be able to deal with it, but some people just can't see blood, or they can't actually handle this bodily fluid. So it's very important to know that it's nothing like what you see on TV or in movies, because medicine is about looking after patients who are sick. So it's important that you know that medicine is not a cool job, because there's a lot of hurdles that you will have on your path, and you have to jump through a lot of hoops as a doctor. So be careful when you think that medicine is what you see on TV. The next reason for not going into medicine is the perception of prestige that you might have when you become a doctor. Becoming a doctor is a very difficult, hard profession to go into. Yes, you will have the title doctor, or you'll have the letter MD at the end of your name, and some people find that there's this perception of prestige when you become a doctor, because society actually believe that doctors are rich or respected members of the society. So that's why there's this sort of admiration from other people. But if you're going into medicine, and you're going into medicine just for this prestige, then you won't have a fulfilling life, because you need to be caring for your patients, and the admiration comes from the work that you do, from what you've accomplished as a doctor, not just because you have this title doctor in front of your name. I still remember when I started working as a doctor, I found it odd when people started calling me doctor, because I don't really identify myself as a doctor. I identify myself as a person first for who I am, and then I became a doctor afterwards. So some people really have this attachment to the title of becoming a doctor, and they really like this prestige. But if you're going into a career, I suggest that you go into a career because you care for what you're going to do, not because of the title you will get from becoming a doctor. So when you go into medicine for prestige, then it might not be really a good reason for going into medicine. Last but not least, the number 5 reason for not going into medicine is if you're not capable of making sacrifices. So when you start med school, you will be making sacrifices. You have to be revising for exams, and you will have to make sure that you're on top of everything. You will be making financial sacrifices, and once you graduated and become a doctor, there will be other sacrifices you will make, because you'll have more responsibilities on you, patient's life in your hands, and you'll find that your time is very limited, and there will be some events, family events, and ceremonies such as wedding that you may not be able to attend, anniversaries that you will miss, Christmas that you will miss. You will need to prepare for more exams after graduation, so you will need to revise, and on your days off you will have to go through questions and other scenarios to prepare to do professional exams. So these are the things that you need to be aware of. In your 30s, you might still have to prepare for exams. You have other commitments in work, so you have to do projects such as audit. So these are the things that will take your time, and some people find it very hard and they struggle because they find that medicine is like a bubble that sucks their life, and it can be very difficult to achieve a good work-life balance if you're going into medicine. So be careful. If you're not willing to make these sacrifices, then you might find that medicine is not a career for you, because you might find that you will regret, you'll be upset that you won't be able to attend some important events in your family life. Some doctors struggle to commit to other hobbies because they are on call and they have to swap their on-call shift, so they find it very difficult to attend weekly classes, for example, and it's very difficult. And if you're going into medicine and are not willing to make these sacrifices, then think again, because there will be many sacrifices, and it can be very difficult that you will find that you're missing all these opportunities in the prime time of your life, in your 20s and 30s. Your friends who are not in medicine may be enjoying themselves while you're stuck in a hospital and having to work and making sacrifices. So this is something that people don't talk about in medicine, but that's a reality. So each time that you're planning to go on a trip, you need to make sure that you're not rostered on the rota, because if you're working on that weekend, then it's your responsibility to swap that with somebody else who is willing to swap it with you, so that you can free up your time and go on that trip that you want. There's also people who've not had annual leave for their own wedding, and they had to change the date of their wedding because they were rostered to work on that date. So these are the reasons why medicine may not be for you. If you're going into medicine for these reasons, I don't want to discourage you going into medicine, because medicine is a rewarding career. If you're doing it for the right reason, you will enjoy medicine. You will learn, because in medicine you keep learning. There's always new updates, and you will learn, apply this knowledge to make a real difference in the life of your patient. And this is one of the most rewarding aspects of being a doctor. When you make this difference in a person's life, and they're grateful for what you've done, and you get the satisfaction that you've made something that really matters in somebody else's life. If you're planning to go into medicine, write down the reason in the comment section why you want to go into medicine. I want to hear from you guys. What's the main reason why you want to become a doctor? And if you've not already subscribed to this channel, don't forget to subscribe for new video every Thursday. Take care everybody, bye bye.